Hi, I'm Sarah Loudon from Total Health Conferencing, and welcome to another episode of inspirED. This is where we take on issues, mostly in oncology, but really issues that affect human beings from all stages and ages. So we are looking forward to a really great program tonight on public policy in oncology. And we're joined by two really incredible people that I've gotten to work with on various other projects in the past, and I couldn't wait to sit down with them and talk about public policy. Bryan Lewis, who's the president of an organization called KidneyCAN, and Erica Terry, CEO of Komen, Kansas, and Western Missouri. I thank you both for being here tonight with me.
Thank you for having me.
Thank you, Sarah.
Sure. I really, from the time that I met both of you, and it was two different times on town halls that we did on patient advocacy, I was so intrigued by, this little corner of the world that each of you occupied, which included public policy. And I've always been really interested in public policy, although I've never been involved in anything public policy related. And that's probably more because I never really knew how or where to start. So Erica, I'm gonna ask you to kind of frame a little bit the conversation to let the listening audience know what exactly is public policy?
Oh, happy to. Public policy, aside from being my biggest passion, is something that anybody can be involved in. And the beauty of public policy is it happens to have the opportunity to have the biggest ROI on making an impact for whatever it is that you're working on, whether that be increased NIH funding on the federal level for cancer research, or working on the state initiative of expanding Medicaid, which impacts all of our world from a cancer perspective. Public policy is the opportunity for people to come together, lend their voices to organizations, call their elected officials, and influence change. Where I get really passionate is the opportunity that as a citizen, an individual, that I can actually influence the laws that dictate the work that the world that we live in. Public policy can also be as easy as voting. We've got actually the most important election cycle of our lifetime coming up, and have the opportunity to be engaged as citizens of the United States to participate in that process.
Well, it's so funny because you kind of cast this wide net on all the different opportunities each one of us have. And I love that you simplified it as, easy as go vote, because that's affecting change and that's affecting public policy decisions. Who you vote for and voting your values certainly translates when it comes to being able to see that reflected in the public space. So I love that you kind of brought it down, right down to that all of us could be involved in public policy, right up to this election cycle, but also talked about kind of big sweeping things, what people do in terms of, and organizations do in terms of, rallying together to have a unified voice to maybe make more specific changes associated with what you're involved with. So Bryan, this past week we worked together on World Kidney Cancer Day, and COVID-19 stole a lot of milestones that all of us have come to be used to, everything from birthdays, graduations, weddings, all the way to things like Kidney Cancer Day, survivor months, or colorectal cancer awareness months. It's like we've been impacted so much by the inability to go out and gather and do together that we've had to create these virtual opportunities to still engage with our audience. Why is it important for you, Bryan, and for organizations like yours to still honor the things that have to happen to reach your community as it relates to, public policy space?
Yeah, that's a great question. And I think there's a couple of ways to look at this. You're right that the COVID environment has definitely significantly and deeply impacted our community as well as the advocacy efforts that we've been trying to do. However, Washington, D.C. still is working. It's a different time there with, social distancing and masks and spacing and logistics challenges, but they're still going about the business of governing, depending on your viewpoints, I guess, on some days.
That's another podcast.
Yeah. So, one of the things that we've done is, we're a smaller outfit, so we've done a lot of grassroots activity on Capitol Hill, and on our previous call, we talked about how we pivoted from doing our standard fly-ins, where we bring people, kidney cancer patients and caregivers and clinicians, to Washington D.C. to meet their elected representatives. We've pivoted, and this August we're having what we're calling district days, where we're inviting patients and caregivers from around the country. Instead of coming to Washington, visit your local elected representative. August is a time generally when every year for the past number of years, it's recess. And so you have a high likelihood of meeting face-to-face with your congressional representative. It's a little bit of a rolling the dice in terms of, do we want to have in-person meetings during this time? So we're planning on the majority of it being virtual, but there are some states, some places in the country that, that have not been as impacted as urban areas, and so they are accepting appointments. So we're going to have a few folks probably meeting with their representatives in August, and we think this is going to be a great time to really have a chance to bring home the message that medical research funding is of paramount importance to our community and all of the cancer community. And we want to have our voice heard. And as Erica pointed out, we're in a country that allows you to go and petition your government. I'm a part of an international organization. In other countries, you don't get to do that. You don't get to always go up and talk to folks. So, we have a special place in what we're doing. We're going to meet and have your voice heard.
I love that. So, along that same vein, Erica, as people listen to this program and, at the end, hopefully feel inspired to be able to share their voice to whatever issues they feel most connected to. Is it difficult to get involved? Beyond the vote, beyond maybe just, lending your voice to a simple phone call or reaching out, is there a way for people, especially at this time when a lot of us are home, where we can get more involved in things like policy?
I think as Bryan just mentioned, we're actually at a really opportune time because we're at home and practicing social distancing, where we have a moment to be more connected with our local and federal elected officials. They are eager to meet with constituents and to understand what is important to them, so that they can best represent, again, for another podcast, we hope that they best represent their constituency, when they're in the legislature. And I think a lot of people think about influencing policy. They think about Washington, D.C. and the federal level, but equally as important, and maybe even more important, is getting involved on your local level. And that can be a matter of writing a letter to your local elected official. And it's as simple as Googling, your state capitol, which has a list of your local state senators and representatives, or your city council, because they're making decisions on state budgets. They're making decisions on whether you wear a mask in public or not right now as part of the COVID recovery. And so I don't think it should be kind of this, or thought about as this big broad thing that you cannot possibly get involved in. Find a passion that you're really, or an organization that you're really passionate about that aligns with your beliefs. And, for example, at Komen, we have a section of our website called Advocacy, where you can sign up and we automatically pop you into our kind of civic engagement piece, where we will send you exact language to review on the phone, or write a letter, or send an email, or talking points for a meeting you might have with your local elected official about the importance of fighting cancer.
It's so, it's so encouraging. I always say this every time I'm speaking to anybody from patient advocacy. It's so encouraging how accessible you make everything in terms of whether it's big policy things that you'd like changes with, or even just, patient to patient calls where someone going through what you either are going through or going to be going through picks up the phone and calls you and says, how you feeling today? And, kind of walks you through side by side. There's so much connection and so much power in terms of like that spiritual, one-on-one, and what we can all do when we do share our voices for each other and for good. Bryan, it's, for me, I feel like that we're living in such crazy times. I mean, in every way, it's crazy. We started the year, now we're in this COVID-19 situation where, half the world believes that we should not leave our house. I'm actually part of that half. And then the other half of the world is like, let's do barbecues and go out and have our summer. That's exactly the way it would have been if we didn't have a global pandemic. And I'm scared of that half, because I'm scared of them, but I'm almost like hopefully waiting and watching to see, are they onto something that I didn't know, so that I can kind of return back to normalcy. But, at the same time, we've got all of this political unrest, we've got social upheaval. I mean, there are so many things happening all at once. And then for the patient living with or through cancer, or for the treatment provider, the nurse, the doctor, the tech, the whoever is the person you're going to encounter, we're almost living in a very different world where we've got to be so sensitive on so many levels. So, when you're thinking about public policy in terms of what's next, how could me, you, us, how could we start to frame what the world we go back to looks like? What do you feel are some of the top priorities in that, cancer and beyond?
Well, there's a lot there to unpack. I mean, I think one of the first things to say is, we live in a large country. What's going on in Montana and what's going on in New York City, you can't really compare. I've been on the phone with some congressional offices, and they represent a large geographical area, and they've had maybe, and this is in rural Pennsylvania, they've had 40 cases of, and this was several weeks ago. And it's been a different impact than it has been in, say, Boston or Manhattan or San Francisco. So we got to be careful when we, try to figure out, are the people going to barbecues and the people that are isolating, are they, where are they? That's a question to ask. I think to your sort of advocacy, political landscape part of your question, I love to think back to Tip O'Neill, who used to say, all politics are local. Mm-hmm. And I think Erica pointed that out as well. Your vote does count. I say that a lot. People don't realize that even in this, age of, we think of mega organizations, your vote counts. It still does. People will listen to you. People in Washington and state capitals and around the country will listen to what you're saying. And, depending on what you're saying, generally speaking, it will have some influence. And so I always encourage people to get active, to go out and do, if they can't, write a letter, make a phone call, support through volunteering, go out and help clean up the street. There's lots of things we as Americans take for granted that we can do. And, one of them, of course, is to protest. And that's something that we have constitutionally is protected. And I'm glad we live in this day and age to see that, and my kids get to see that. So I hope that sort of answers where you're headed. As far as the future goes, I was talking to our friend Ralph Knapp the other day and others, and they're like, Bryan, we hear the word optics a lot. Does this look good? Does that look good? How will it play? People are dying. Yeah. People are dying of cancer, and we're the wealthiest country in the world, and we need to continue to spend and robustly, support medical research. And so get out there and get your voice heard.
Yeah, no, I love that answer too, because it does take, so much of this public policy discussion, again, on any front, comes down to what are the outcomes? What are the desired outcomes? You know, people aren't getting out there and protesting and going through all that they're going through just to have something to do on that particular weekend. It's like something is happening, whether, you know, in the cancer world, we put these focuses on different tumor types throughout the year so that we can really kind of condense all of our efforts and make something happen that's favorable to the population that it affects. But it's still so overwhelming. It's like there are so many things happening. And so, you know, just to hear you say that we live in a place and in a time where, you know, everything as simple as our vote to actions to things that we don't think about are important. I think that that's really encouraging because, again, it kind of takes this broad brush of, quote, public policy and it makes it into really actionable things that the everyday person can get involved with, no matter what, you know, side you sit on various opportunities. I think the one side we all sit on is we all want to see progress, and we all want to see progress that, you know, lifts everybody, especially people that are fighting through cancer.
Go ahead, Erica.
I was just going to say, you know, what we're witnessing right now with the attention and kind of enlightenment of social justice being as a national dialogue right now is actually the beginning stages of what will be a robust kind of critical look at all things public policy. If you think about movements over, you know, history, and I'm thinking from the cancer world. So 30 plus years ago, Susan G. Komen died from breast cancer. Her sister, Nancy Brinker, said, I'm going to do something about this, and created a movement. She harnessed this power of women coming together saying, I do not want my mom or my sister or somebody I love to die from breast cancer, and created a movement. And from doing that, Susan G. Komen was able to generate and invest over $1 billion, second only to the federal government, in breast cancer research, which other disease types have also benefited from that research. You know, that when we think about public policy, we talk about voting and we talk about talking to your elected officials. It's also a part of being a part of the conversation and being at the table, which is what we're seeing right now. And you had asked, you know, how do we go back to the normal? I actually really hope we don't go back to what we were. I really hope this is a moment of, like I said, enlightenment and change. Because it's kind of a reset for us as a society to reevaluate our priorities on how we treat people, what our health systems look like, how we fight cancer. You know, how do we correlate the notion of, you know, the unemployment rates have skyrocketed and go up every day, which means benefits are lost, insurance is lost, and that means a whole new population is without health insurance now. And so do we value those people? And are we willing to, for the states that haven't expanded Medicaid, are we willing to go and, you know, expand Medicaid for the states that that need to make it happen to help those people? It's a really interesting conversation that's kind of happening publicly. And I'm quite frankly very thankful for it, because from my perspective, I talk about this with my team and my board every day. We cannot achieve our mission to end breast cancer forever if we don't mean everybody. So health equity is top of mind, and I'm so thankful for the dialogue, nationally speaking, taking place.
Mm-hmm, mm-hmm. Bryan, were you going to say something?
I'm sorry, I was thinking about another topic, so sorry, I lost my train of thought there. I was listening to Erica.
Sorry, Bryan.
No, that's fine. So, I mean, you know, again, it all starts with small steps, right? Like when you think back to all the transformative things that have happened in our country and really in other countries, you know, the globe, it's all small steps. It's like one catalyzing event or a series of catalyzing events that are followed by people saying either enough or people saying we need, you know, substantive change. But at the end of the day, really what kind of pulls it through is staying power. And I mention this almost every time I talk. I've got a 17-year-old, and with that 17-year-old, I've got, his group, his little tribe of 17-year-olds. And, I look at everything from the types of TV shows that are out to, all the different things. We've got this reality show, overload. Social media has shortened all of our attention spans by significant amounts of time. We've got a media cycle that seems to be like, let's, get to the next thing, to the next thing, to the next thing, and doesn't really kind of stay true to keep reporting on stories. Bryan, I'm going to start with you because I want to ask both of you, do you fear that the culture in the United States, and I think I can probably say broadly, even though state to state there are differences in kind of culture, but broadly, do you think that we've raised a generation of people that when you think back to like our parents and our grandparents' generation have a completely different definition of staying power than that we do, that eventually leads to the type of change we want to see? Bryan, I'll start with you and then I'll ask Erica the same question.
That's a great question. That if I'm using my children as an example, then the answer is the perseverance and the staying power has been shortened dramatically compared to previous generations. But that's a biased parent speaking.
Yeah.
I do think that what you were alluding to, social media and entertainment and television and all the different ways that we receive information and content, via the internet and other ways, it has just changed our attention span. We are now a country, and I think a lot of folks, we had an impeachment in this country 5 months ago. Do many of us talk about that? We move on to another topic. Of course, COVID has taken all of the air, and now our critical race challenges we have in this country. So, we're a country that we're Americans. I'm proud to be an American. We have staying power to persevere through tough things. We'll get through this. I feel confident. We will have a lot of novel responses, I think, coming up in terms of, the landscape has changed for telemedicine. The landscape has changed for, how we're doing meetings, how events are going to take place. I think it's going to be interesting to see. I've noticed personally that there's a lot of pent-up demand for human contact. We've had some small interactions with neighbors and other things, and people are, have this pent-up desire to communicate and be around. So how do we deal with that, when we're transitioning everything to a virtual, landscape? So it'll be interesting. I think, Erica, you're right. We're not going back. There's no going back. There's only going forward and how we're going to change and pave a new future for all of us.
Yeah. And Erica, I'm going to ask you the same question, and this time I'm going to add, again, I have an inherent bias here, but I think women are different. I even would go as far as saying girls are different, like even the younger generation of girls.
Great.
I think once you get into a position where something affects your girlfriend or something affects your sister, it's like there's an emotional connection there that causes that staying power for that next generation to be a little bit more significant. But I still fear that attention span of what's next, what can I get involved with next? This is my summer project. This is what's happening on the news today, but tomorrow it's going to be something else. How do you feel that's going to change or impact, or do you feel that that's going to change or impact public policy as we move forward?
I don't think it will impact or change public policy because, as one of my all-time favorite presidents once said, the arc of history always bends toward justice. And if we're thinking about in a climate right now when we're focused on social justice, and when I think about my lane, how I can play a role in achieving social justice, and that's through health equity, from a cancer perspective at least, I have a feeling this is going to stick, and the moral compass of America is actually really good.
Yeah.
again, it'll bend towards justice, and justice is that we, as defined in our Constitution and Declaration of Independence, all are created equal. So I don't know, something's different about what's going on right now. And parallel to that with COVID-19 and us thinking about, COVID-19 as a great equalizer in our society. However, unfortunately, COVID-19 has lent a massive microscope on the inequities amongst our population. So I think that, and then certain things that have happened recently have kind of exacerbated a movement that people are just done. And people want action. And I've been saying it's not enough to put kind of a black square on your social media to say that you stand with a community. You got to take action. And that's where public policy can play a role, because again, as I started off our kind of conversation, it has the biggest ROI to actually make a difference. And all you have to do is vote.
Yeah.
Which is a pretty powerful thing if you think about it.
It is a powerful thing. It really is a powerful thing. Bryan, what got you into this work?
I had twin 1-year-olds when I was diagnosed in 2007, stage 3 to 4 kidney cancer. And, I couldn't leave my wife to raise twins by herself. So I was very fortunate to have that as a motivator. I've been very fortunate with this medical team that I've been able to work with. They've been a little bit more aggressive than others. And so, I lived on Capitol Hill. I lived 11 blocks from the House and the Senate. And one of my good friends said to me one time, Bryan, you're not supposed to be here. You need to get back and do something about this. And so that was the genesis of the idea. So I started making appointments on Capitol Hill with some of the House and some of the Senate folks, and just started, wearing out my shoes going up on Capitol Hill.
Did you have a background in anything political?
Well, I'm a political science major. I worked at a trade association in Washington, D.C., and we had done some legislative work on Capitol Hill, but I wasn't at the front lines. I was sort of in the back office doing legal work and other things. So, but I had tasted enough of what it took to go up on Capitol Hill and how meetings work to get at least started.
Oh, that's amazing. And Erica, you said you're a political science major too?
Yeah. That's the degree people are like, what am I going to do? I go to law school or become a professor. But it's actually, we've got an interesting career path where you can be working for a for-impact organization and make a difference that way.
Absolutely. And how did you get involved in Komen?
So when I was 23 years old, I was engaged to a gentleman. We met in Washington, D.C., actually working there. And when he was 25, he was diagnosed with glioblastoma multiforme, which is grade 4 brain cancer. He was 25 years old. I was 23. We were engaged. His family didn't want to step in and help him, so I became his primary caregiver, and we went down to MD Anderson for 15 months for his care and 5 surgeries. And he passed away when he was 26 years old, and I planned his funeral when I was 24. And that experience obviously changed the lens in which I view everything in the world now. And it made me want to do everything I could to fight cancer. Right after that experience, I went down to Austin, Texas and worked for Livestrong back in the day, which that was when they were creating the Livestrong movement and everyone had a wristband. And I really got to see and experience the opportunity of a movement inflicting change on Capitol Hill. And I said, I got to do this. This is powerful, it's uplifting, and I actually feel like I can do something about this disgusting disease that has, impacted my life, but also impacted thousands and thousands of people. And then I was led to Komen, and there's something about the notion of taking a movement and doing everything you possibly can to intentionally go out of business, which is that's my mantra. I say that to my staff all the time. Our goal is to intentionally go out of business because we want to achieve our mission. One way we can do that is through public policy. So
I love that. I mean, what a wonderful thing. And both of you, as we were talking about catalysts for change in public policy, I mean, there's these catalysts for change in individuals too, where you're going along life and then something, you encounter something, and it just transforms you from the inside out, and then you sit in that seat going, what can I do? What can I do? I think that that's a soul question, right? Like, I feel like you see something and I feel like people inherently say, what can I do? So Bryan, you were going to say something.
Yeah, because there's another piece of that, and I'm sure it's for Erica, which she's living, which is you do it for others that can't. There are, if you're in this community long enough, you see a lot of death. You see a lot of tragedy. You see a lot of people left behind. And I'm one of those fortunate ones that gets to be here, and I can't sit around and wait for, optics. We've got to keep moving forward. And, those people that are unable to come to Washington or unable to go and talk to folks, that's what our community is trying to do. We're picking up the, we're doing it for others.
Yeah, yeah. It's funny because I feel like everybody who's involved in the medical team, like we are involved in medical education, and we always feel when all of this stuff started to happen, even before this stuff, but really it put a spotlight on it. Like, how do you get critical information to someone that's going to be seeing a patient in clinic? And if they didn't encounter us, they're not going to be able to give that person, the latest, or they're not going to know something that person, and that person could be my mom, my husband, my kid, me. It could be, so it was like the way we were trying to figure out how do we get through this COVID thing was, how do we break the barriers down that COVID put up in our ability to deliver information? And I feel like, having heard from both of you in the town halls, you are very much in the same situation, both being parts of and heads of large advocacy organizations, where you're going along and all of a sudden it's like a big wall popped up, and you have to say, people still need us. How do we get to them, and how do we let them or invite them to get to us in these kind of safe spaces? So Bryan, since we, as we're talking about COVID, and as we're now, I don't want to say through it, because we're by no means through it, but we've learned what we can learn to this point about it. Do you see, you mentioned things like telemedicine and other things that might be here to stay. Do you see that there are things here to stay in the advocacy world in terms of what we've learned we are still able to accomplish?
Well, I think the one thing that Erica highlighted, which, some of these circumstances that we've all been through, the country is going through, touched a nerve that has created this groundswell of folks, saying enough, saying we need to do some things differently. I think that you're going to see, some of that play out here over, through the election cycle, as well as going forward with issues around access to care. I think, there's a lot of issues out there where there's, a growing disparity between, sort of the haves and have-nots of the world. I think we're going to see some change going on there. I think a big piece of this is trying to figure out, okay, people are upset, people are raw, there's a nerve that's been hit. How do we turn that or channel that to positive things? And how do we decide what those positive things are? That's going to, be a tough debate, discussion. But there's so much energy behind this that we as a country, we're at a pivoting point where we can make some big decisions about the future. It's whether we can all come to the table and agree on things, I think.
I know. And the divide just feels wider and wider. But one area that we're, I believe, not divided on, Erica, is that during this crisis, there's been a lot of shifts in regular routine screening and what we call essential visits for monitoring for recurrence. And so I was on an educational call the other day where someone said, we're just getting ready to see another crisis, another pandemic.
100%.
Where does Komen stand on right now in this moment? What are you saying to women about routine screening?
So we're saying it's very important to resume your routine screening mammograms. You know, what we're seeing in preliminary data from a report that I recently saw showed that the average screening mammograms in the United States weekly prior to the national pandemic being declared a national emergency or worldwide emergency, there was about 10,000 screening mammograms taking place average weekly in the United States. March and April and May, it plummeted at 529 screenings a week in the United States. So that data point tells us a couple of things. One, people listened and they stayed home, which was great. But there's huge ramifications that we're going to have to deal with in I don't know when, but a post-COVID recovery world. The health systems, even if they were to stay open 24 hours a day, there's no way they can make up all of those screenings by the end of the year. Patient accrual, another piece of this also is clinical trial, clinical research participation. I sat on a call that the NCI director spoke on and talked about how during COVID, March, April, and May, clinical research, clinical trials essentially halted patient accrual. And that might not sound terrible in the sense, but when you think about the trickle down effect of what patient accrual means for a therapy that needs to recruit so many people in order for the trial to get approved or to move on and get FDA approval, that means therapies that would be approved by the Food and Drug Administration won't get on the shelves for patients to save lives. The entire implications and impact of COVID-19 on the cancer world, as you just said, is actually another pandemic that people just aren't talking about. And I am very fearful. We've got screenings have declined. People are scared to get back in the clinic because they're worried they're going to get a virus and don't understand the precautions that hospitals and clinics are taking. We have clinical research that is essentially halted. For patient accrual. And then we've got, as I mentioned, an entire new population that is now finding itself without health insurance for the first time, probably in their adult life, which means not access to preventive care or just routine screenings because they don't know where to go to have those things covered. So we're on the verge of something that's pretty incredible. And I actually believe organizations like ours, like Bryan's, are going to be critical moving forward to stay in existence and to continue to be around to help reach those people that need it the most, you know, in the kind of recovery piece of COVID.
Bryan, that's an interesting point that Erica brings up. You know, we talk about movements, but there always need to be leaders in movements. And I wonder if this is not a catalyst, you know, everything Erica just said, which I agree wholeheartedly with. This isn't a catalyst for advocacy organizations to pick up that banner and say, wait a minute, you know, there may be division in all of these other areas, but we've got to stay aligned and, you know, in cancer care, in cancer screening, prevention, treatment. Do you see an opportunity for that? You know, we had Stand Up to Cancer. We have all these huge organizations, but do you see an opportunity to have one voice speaking to, you know, our nation, kind of reinforcing the importance of all of these things and how to prevent some of that trickle down negativity that we've seen?
I mean, you actually named one of the coalitions we belong to, which is One Voice Against Cancer, spearheaded by the American Cancer Society, represented by about 40 plus different cancer organizations, talking, you know, primarily about robust and sustainable funding for the NIH, the National Cancer Institute. So that's going on. To your question about, you know, can advocates fill into this space, and can we be unified? You know, we've seen in the kidney cancer community a willingness to share some dialogue and some best practices around what our advocacy asks are, because I think we all can agree that if you have multiple voices saying different things from the same community, it gets diluted and ineffective right from the start. So we're trying to harness that one voice mentality in the kidney cancer space. But I think across cancers and cancer groups, I think there's definitely this support, enthusiasm to come together even more. And thankfully, cancer research is one of the few bipartisan issues that gets support, on both sides of the aisles. And in this environment right now, having, less of a face-to-face opportunity with, our representatives, and now doing these, we're doing what telemedicine is doing right now. We're having these kind of conversations. So with legislatures, you're going to have these kinds of conversations. So we have an opportunity because of that support and bipartisanship.
Yeah. There's so much to be done. There's so much to do. There's so much to be done. Sometimes, I'm sure both of you feel it, that there's too little people, too few soldiers on the field. But, at the same time, I feel like there are so many people looking for opportunities to give, looking for opportunities to kind of get connected to things that matter. I also believe with all my heart that we're headed into a mental health crisis post this COVID and race relations and all these things, that we're not, as a health system, as school systems, as parental systems, that none of us are equipped to handle. Because, Bryan, when you mentioned people are craving that physical connection, we can only be isolated so long. And I do think that all of us have that inherent need for connection. It's not just like a desire. And I see it in my 6-year-old, I see it in my 17-year-old, I see it in me, I'm 43, my mom's 75, it's cross-generational. And it's definitely something that also no one's talking about, that, how do we kind of get through this very dark time in our history. Well, we've only got about 10 more minutes-ish to go, and I want to ask some personal questions. Erica, I want you to share maybe the most significant thing you've done since you've entered this arena of advocacy, of public policy, of kind of being the voice for people that may not have a loud enough voice.
Oh gosh. I don't know. I think, so I love the opportunity of inspiring others to be involved and to understand that you don't have to have a PhD. You don't have to even have a full-time job to be engaged in influencing change. Anybody can do it. And quite frankly, the stories that are shared with an elected official are more powerful than any data figure that I can throw out. As Bryan said, I love the idea of district days. I think I might steal that from you. That's an incredible idea. But
we're happy to share any information we've got.
Awesome, thank you. I think one of the things I'm most proud of is initially when Livestrong, back in the day, I'll share just a brief thing, decided to pull together 2 advocates from all 50 states on Capitol Hill and have a Livestrong Day in Washington, D.C. And obviously advocate for NIH funding for the NCI. And we pulled it off and inspired a group of people who went back to their community and each pulled together a group of 100 advocates to each advocate in their state and take the message back. So it truly was a grassroots movement. I learned a lot from that experience that I'm using today, the power of inspiration, the power of motivation, and then the power of change in and of itself is a pretty powerful thing.
Yeah, when I think back to Livestrong, I wonder, is there always, or does there always have to be, in your opinion, before I move on to Bryan, does there always have to be kind of like faces of movements? Do you think that that's necessary in order for something to kind of catch fire? Or do you think it could be done, that true organic grassroots?
Yeah, I mean, you know, if you're referencing a person, obviously it didn't hurt to have a you know, a national celebrity superstar at the time who was also a cancer survivor face the movement. But I don't think it's necessary. I think the message, the power, and the message in and of itself can inspire thousands of people to get involved, you know, no matter who they are, what they do. If you truly believe in it and it is something that you feel you can make an impact on, I think the sky's the limit, quite frankly.
Yeah, it's kind of like that Susan Komen, Nancy Brinker story.
Mm-hmm.
that little story that happened,
Yeah.
that fueled the most incredible movement.
And, you know, one of my philosophies and mantras is we don't care how change happens, or we don't care who gets credit for whatever change we're trying to advocate for. We just want to get it done. And I think any organization that moves forward with the mantra of we just have to do what's best, regardless if our logo is on it, regardless if our person is the lead speaker at the news conference or not, that's when you can really show your true colors to constituents, to your supporters, to show that you mean what you're saying and you mean what you're advocating for, and the rest will kind of just follow suit. People will follow that.
Yeah, thank you for that. Bryan, how about you? When you think about, you know, significant moments, significant impacts, something that you can say, it's because I was involved, or it's because I put all my passion and energy that thing happened. Do you have a story to share?
Sure. 2016, 4 years ago, kidney cancer had $0 dedicated federally for research. And in 2017, we got $10 million appropriated for kidney cancer specifically. And that's now grown to 40 million. And so we're, as a community, there's a lot of hands involved in bringing this off, and we're just ecstatic. It's created a renewed interest in the early investigator pool of folks. There's, you know, young investigators who are saying, maybe this is an area I need to spend some more time, and maybe I can build a career there, where, you know, previously they would, no offense to the folks in prostate and other places, you know, they would go to where there's an opportunity to build a career or have a laboratory. And now we're starting to be in that space. And so I see that as a really significant turning point for us. I'd like to just go back to your mental health comment a couple of minutes ago, which I do feel like all of the cancer community is being impacted. You know, Erica, you touched on some things, but, you know, fear, uncertainty, you know, delays in scans, delays in surgery, you know, potentially life-saving surgery. I mean, there's definitely going to be a significant, and already is a significant impact on the cancer community with those issues. How I see the silver lining somewhere in there is, this is the time to, if you've been impacted, empower yourself, get out there and do something. Come and join us, join your local organizations that are doing things. And if you can, you know, not everybody can, but if you can, get out there, you make an impact. And so this could be the opportunity to harness that energy.
Definitely. No, I mean, I do think that the call to action from this is, you know, if you're home looking for something to do that will change your life, that will change the life of other people, something as simple as visiting a website. Actually, I want both of you, Bryan, if you could give me your website, just call it out. We'll also put it on the end piece of this, but
sure.
Call it out for
it's
us.
KidneyCAN.org, KidneyCAN.org.
And Erica, you too, for Komen.
Yeah, I'll give you the national, Komen.org. We've got a public policy institute that has fantastic resources for civic engagement. Yeah,
so, you know, you're home, you're sitting, you're looking for that thing. I know, you know, there's so much of me. I'm working harder than I've ever worked before in my life, I can say. So it's not like, you know, I've got oodles of time left, but I feel sometimes that my work is, I don't get a break from it. And I don't mean to say that public policy or getting involved in something like this, you know, it should be looked at as a break. but it does something for your soul to give to someone else without any expectation of getting anything back. You know, lend your voice, lend your signature, you know, lend your hand, pick up the phone and call someone. There's so many people right now that are, you know, sitting home alone. They don't have a family and friend, you know, infrastructure in their own life. They're sitting home alone, and advocacy organizations have such an enormous ability to connect those communities. And there are never enough soldiers on the field. So even if you said, well, you know, I can't commit to all of this time, commit half a Saturday, you know, like do something little, incremental changes. Because I do feel like once you kind of put your toe in the water, you're going to want to go all in, feeling that feeling of what that little thing can do. Get your kids involved. It's a good activity to do with your teenagers, to show them, you know, this is the way to make change. It's not always just about social media posts. Get out and do something. So
yeah, Sarah, just to add to that, I agree. I couldn't agree more. And I think there's a couple of things there that you touched on. You know, one is it's so easy to complain. It's really easy to complain these days, depending on, no matter where you are, you know, what's going on. There's a lot of things that are negatively impacting us all, and we can complain. Or you can, you know, get up and do something like you've said. And political advocacy is one avenue, but I think what you've talked about in terms of picking up the phone and calling a friend that you haven't spoken to in a long time, or finding out if there's, you know, a patient that you can deliver a meal to, or you can even just call them on the phone and see how they're doing. See if, you know, those are the kinds of advocacy efforts that are impactful, as well as, you know, going to Washington, D.C.
yeah, no, for sure. And you know, there's so much that we can learn from each other. I have a friend who, so we live in kind of don't want to say affluent, but it's like a, you know, a nice community. I'm saying a wide community, the city that we live in. And I have a friend who's like a bleeding heart. I mean, every time there's a fundraiser or something, she's like first in line. She's bringing the cupcakes, she's doing everything. So when all of this started to happen, you know, people started to get really nervous, and then you couldn't go to nursing homes, you couldn't really go anywhere. So she started this thing where she invited friends to go to places where, you know, you might know that there's a homeless person that sits around, and instead of giving them a sandwich or a dollar, whatever she traditionally did, she invited herself to lunch with them. And she started posting about who these people are, not who they were, who they are. And I believe so much with all my heart that there are people all around, you know, us, Erica, Bryan, and Sarah. You collide with each other for something, and then you dig a little deeper and you dig a little deeper. And pretty soon you see this person is kind of fantastic. Their stories, you know, their impact, their passions, and they're a lot like me. And I feel like so much of that's missing too, that we kind of all live in our own bubbles. And we don't necessarily see that, you know, the Republican or Democrat is a lot like me. The Black or white or Hispanic is a lot like me. The man, the woman, it's like we've lost that ability to kind of look for the things that connect us and instead kind of stand fast on the things that divide us. So I do think that there's, you know, an opportunity too to individualize this, which then leads to doing things that affect change. But all of us have to be invested in it. It can't be we're leaving it up to the Komens, the KidneyCANs, you know, the bigger organizations of the world to do it. Like, we've got to get involved now. So I think these are great places to start in, you know, talking to real people that have given their life to causes like the two of you have done, to see that, you know, not only is it rewarding for all of the obvious reasons, but it's rewarding because now you've built a legacy, that because you decided to say yes, things transformed so significantly. And I love to know both of you doing that.
I just want to add to that, you know, there's a fact that I think goes under noticed, which is that there are 15.5 million cancer survivors in the United States, I think now. I mean, that's an army.
Yeah.
And if we could harness them, you know, as a voice, And you know, many of us are trying to, and we're having some success. But if we really got that harness, you know, we could make some things happen as well. And so,
yeah,
you know, there's hope. We'll remain hopeful.
Yeah, we have to remain hopeful. All good things come with hard sacrifice. So we will remain hopeful. Well, I'm so grateful for the both of you. I told you that an hour goes by fast. I'm grateful for the both of you. I will do everything I can on all of our social media channels and with all of the people that we call, you know, customers, peers, friends, etc. We will share everything we can in terms of how to get involved in KidneyCAN, in Komen, and in other organizations and other causes. I thank you both for sharing a little bit about your life and about your work with us as an audience. I knew from the first time I spoke with both of you that there was a spark that I wanted to share with the people that I can influence. And so let's stay in touch. Let's make sure that, you know, we continue to work together to innovate, to reach our audiences. Rely on us as much and whenever you can. Like Bryan, we loved doing that with KidneyCAN, the Get Up and Move Day. And, you know, just continue to consider us partners and friends. And I really do look forward to the time where we can meet each other in person. Maybe we'll all sit and have a coffee, or better yet, a martini on Capitol Hill. And I do want to end with one really awesome thing for our viewing audience. You know, I want to take a moment to give you a little bit of insight on the power of a working mom. So when Erica first started this podcast, I saw this little monster creep up next to her, and she did what all moms and all dads have been doing on Zoom calls, like slowly push the file off the camera. And then there came a point in the podcast where we heard a little rascal, probably some kind of pup, some mid-sized pup, calling for attention. But you know what's so beautiful, I think, about this time that was almost like unthinkable or unforgivable in the past is we've gotten to be able to treat each other as individual human beings that all have the same stuff going on in the background of our life. So Erica, I commend you for trying on during family time, and I thank you too, but you gotta admit, there's nothing like a working mom.
Amen.
So thank you, my dear girl, and know that we all stand with both of you in your work. Thank you again for being with us tonight, and we look forward to doing this again in the future.
Thanks for having me.
Thanks for the opportunity, Sarah.
Okay.
Thank you, Erica.
Thank you.
Appreciate the opportunity.